syndrome, tics, embarrassing, Tourette's. Tourette syndrome is a neurodevelopmental condition which affects 1 in 100 people. That means about 300,000 children and adults in the UK have Tourette's. What is Tourette's? This is when a person moves or makes noises without wanting to, involuntary. And these are called tics, and there are 2 types, motor and vocal. So motor tics, this is when people smell objects, can be pulling out hair, biting or touching, twitching, self-injurious behaviours, unusual or excessive eye blinking, and repeating others' actions, and this is called echopraxia. Then there's vocal tics, which include throat clearing, making animal sounds, coughing and spitting, shrieking, whistling, sniffing and grunting, repeating other people's words or phrases, and this is called echolalia. And for tics, they get better and worse, and they call this wax and wane. And tics are more severe in times of stress or tiredness or excitement. 80% of people will have additional conditions. This can be ADHD, attention deficit hyperactivity disorder, OCD, obsessive compulsive disorder, ASD, autistic spectrum disorder, and anxiety, which is normal until it interferes with daily routines. Now 10% of people have the swearing tic, and this is called coprolalia, as well as non-obscene, socially inappropriate behaviour, shortened to NOSI. For example, this might be making remarks about someone's height or weight. So a signal or a sign. People with Tourette's get a signal before a tic arrives, and it can tingle, it can burn, or it can be like an itch that you can't scratch, or a sneeze that you can't stop. And tics are like hiccups. You can't plan them and you don't want them, and tics are exhausting and they can hurt. Tips for school. You can ask about exam arrangements and speak to your special needs coordinator. Differentiate tasks where possible. Help to manage anger and reduce stress, and it's important to have a safe space to retreat to. How to get a diagnosis? Well, you must have multiple motor tics and at least 1 vocal tic for 12 months. But be cautious, Tourette can be misdiagnosed as Sydenham's chorea, epilepsy, or dystonia. You must speak to your doctor. So managing. Tourette syndrome usually starts during childhood, and the tics and other symptoms usually improve after several years for some, and can go away completely. But there is no cure, but medication and therapies can be really helpful. Tourette syndrome, don't let it stop you.